Hey y'all, this is a vaginal delivery setup. For instance, you would need a vaginal delivery pack. You would find that in the second supply room going towards mother baby, in the very back towards the left-hand side on the very top rack. Also, you need the OB delivery instruments. You would find those in OR2 in the second door, bottom right-hand side. Then you need a 20cc syringe and an 18 gauge needle found in the first supply room going towards mother baby, and a needle counter that's in the second supply room in the very back top, right by the pillow in the bend. Also, a set of sterile gloves to set the table up. These are located beyond the monitor. As you see, we're going to set the table up. You would first take the pack, open it sterilely away from you, pulling it back to the side and then the other side. Then you grab the needle counter. You would open it sterilely, peeling the top of the package, popping it onto the table. And then this is the syringe doing the same thing, peeling the top, popping it on the table. Then there's the needle, the 18 gauge. Both of this, the syringe and the needle, are used to draw up the cord blood. And then we have our instruments. We're going to open them sterilely, opening it away from you, then side to side, and then gently just laying them on the table, not to cause any breakthrough or strike through. And then you get some gloves, opening them on the table. Keep in mind, this is a clean, contaminated case. So we are going to open the gloves and put them on in an open, sterile environment. Okay, and as we do that, we place these things in order of use for the surgeon, not knowing whether it's going to be a fast delivery or a calm delivery. And you have 10 instruments. That is verifying sterility. And she's laying her instruments down, her towel down where her instruments can go on top of that, making sure that nothing breaks through the paper on the reinforcement tablecloth. That is a Kelly, another Kelly, and they use a curved Mayo to cut the cord, and a straight suture scissor, forceps, a sponge stick, another Kelly, a needle holder, and a smaller needle holder. And then you have your syringe. You put on the needle, you lay it on the thing where they can draw up the cord blood. You have a needle counter. So if you have a second degree, first degree, they can put their needle protector in there. The needle and the needle protector, excuse me. In the package, it comes with a gown, under buttock straight. There's a gown, under buttock straight, some towels, Ratex 10. You must count these when you open them up with the 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, total of 10. On the 10th one, you're gonna make a sponge stick. So at the end of the case, if the doctor, with the blue on the outside, so if the doctor needs to go in to the uterus and check for bleeding or clots or whatever. That is a syringe, 12 syringe, and a cord clamp. And this is a flap. So you're putting the stuff in there according to the use. So you're wanting the sheet that goes across the abdomen, on top of the under buttock straight, a gown, and then you have a sheet to cover it. Keep it as clean as possible.
I always wanted to be a flight attendant.